It's a Northwest News Radio weekend. Now, back to IRG's Health Talk.
Well, next up we have, as our guest, Dr. Anthony Yee, a foot and ankle orthopedic surgeon at Seattle Orthopedic Center. We're talking about ankle instability, and that's something I certainly have gone through, Shannon, with 7 operations. I had my foot fused a couple of years ago, and so I don't really have an ankle per se, but there are ways to get about treating these sorts of disorders, and Dr. Yee is going to talk to us about those.
That's right. You probably experienced an ankle injury many, many years ago, Tom. Your ankle was probably a little bit unstable, probably lent itself to kind of hypermobility, some arthritis set in, and that was probably your kind of genesis of what your condition. Ankle instability can be treated, though, with surgical intervention if needed.
All right, Dr. Yee and Shannon O'Kelly.
Dr. Yee, welcome to Health Talk. How are you?
Doing well. Thanks for having me. I'm excited to be here.
We're excited to have you. Hey, tell our listeners kind of what your practice looks like today and your background, your education. I'm always intrigued, the hard work and the effort that folks like yourself put in to hone your craft, so to speak. I mean, you have a fellowship, and that's pretty specific training. But let's start from the background and give us a little background on Dr. Yee.
Sure. Yeah. So my wife and I actually both grew up in Tacoma, Washington. But I'm an orthopedic surgeon with a particular focus in foot and ankle. I practice at a group called Orthopedic Specialists of Seattle. We have locations both in Wallingford and Ballard. In terms of my education, I did my undergrad and medical school at the University of Southern California, so go Trojans.
Yeah, there you go.
And then afterwards, I went to the University of Washington for my general orthopedic surgery training. That was for 5 years. I had an excellent education there and very grateful for that. And then I did an additional year, specifically a fellowship in foot and ankle surgery at Harvard Brigham and Women's out in Boston, where I learned a lot from my really good friends and mentors. And now I'm back in the Seattle area and practicing and really enjoying being back in the community where I grew up.
Absolutely. You know, I did my graduate training in Los Angeles, and just based on the population and the things that happen in LA as an orthopedic surgeon, I'm sure that training was spectacular in some of the things you probably dealt with. But more importantly, this fellowship that you did, I mean, I think our listeners need to understand what that means, and I really appreciate you're a foot and ankle fellowship trained orthopedic surgeon. Maybe drill down on that fellowship, the length of time, what you see, what you learn. I mean, it's very specific training.
Yeah, absolutely. So, for an orthopedic surgeon, they go through 5 years of residency training where they training from mentors that teach them the general principles of orthopedics and everything within orthopedics, whether that's, spine, sports injuries, pediatric injuries, even musculoskeletal, you name it, everything that has to do with orthopedics, where we get a firm foundation and training in all facets of orthopedics. And I would say most people after that want to do further subspecialization. So whether that's focusing on joint replacements or sports injuries or children's. And I decided to go pursue additional training and fellowship in foot and ankle specifically. And as you can imagine, every subspecialty is pretty nuanced and has some finer details. And I'm really grateful for that year that I spent out in Boston, where I was able to really learn a lot. One of the passions that I gained from that was minimally invasive surgery, which is performing surgery through incisions that are as small as possible, but still safe and effective, with the thought of helping patients really recover faster, have less pain.
I'm going to give you a little challenging test here. Here's a quiz for you. I'm an athlete, or a young recreational athlete, young adult. I have sprained my ankle maybe several times in the past, and now my ankle is just not stable. Where do I go?
I think, coming to see an orthopedic surgeon like myself would be a great option. That sounds a lot like somebody who's developed what we call ankle instability. A lot of us just shrug that off, but some people unfortunately don't make a full recovery and continue to, have feelings of instability or describe their ankle as being weak or constantly turning in on them or giving out on them.
We'll be back with more from Dr. Anthony Yee and Shannon O'Kelly after this time out on Northwest News Radio.
It's a Northwest News Radio weekend. Here's Tom Hutler and Shannon O'Kelly. This is IRG's Health Talk.
Our conversation continues with Dr. Anthony Yee, foot and ankle orthopedic surgeon at Seattle Orthopedic, and Shannon O'Kelly.
Dr. Yee, again, thank you for joining us on Health Talk. We're talking about ankle instability. So someone that has an unstable ankle, what are they going to be experiencing? And they're going to go to an orthopedic surgeon like yourself, but maybe take us down that road, the examination, the possibility of maybe intervention, what type of intervention, return to play. Give us the whole kind of 9 yards ankle instability lecture.
Generally, patients often come in reporting that their ankle feels weak or that they've had many sprains and that it turns in on them. Sometimes that can be even with minimal provocation, like even just walking down the street on a flat, even surfaces, but more often when they're challenging the ankle on uneven surfaces or doing something high impact. But they've oftentimes tried a lot of things like bracing it, physical therapy, and are still having issues with it. I think the most important thing is for me as a provider is to listen to you and figure out what's going on. How often does this happen? When is it happening? Have you tried anything for it thus far? My first go-tos are trying things like a brace and physical therapy, which I think is very key, especially working on things like proprioception and balance to really make sure that we can do everything we can, short of a surgery first. And part of the initial visit that I often, do an examination called an anterior drawer test, is which I grab the back of the heel and try to pull it forward. And I compare it to the other side to see if basically the ankle feels looser than the other side. Usually an x-ray is fairly standard in the workup for this situation. As you know, people that turn their ankles in can even have injuries to their bone or cartilage that I don't want to miss. And if I'm really suspicious about it, I'll even send them for an MRI for that. In terms of, you asked about the treatment options. If someone is just not at the spot they need to be and are not able to get back to doing the things they need to do or love doing, despite us trying everything short of surgery, that's when I bring up the subject of surgery. There's something called a minimally invasive Brostrom procedure. Basically, it involves reconstructing the ligaments on the outside part of the ankle so that they're functioning properly, so that your ankle is no longer turning in or weak or unstable. In that procedure, I like to perform through what we call arthroscopy, a series of very small incisions, just a couple millimeters in length each, that generally only require 1 or 2 stitches each. And I start by putting a camera inside the ankle and looking, just to make sure that there's no other injuries and to confirm that we're there for the right reasons. Doing it through this method, I've really had some good success in terms of getting patients to get their weight bearing and rehabilitation jump started very early on. And I've had patients that are very satisfied, and I've been really happy with this.
Well, it sounds like a great option for someone who has got some instability in their ankle to get that corrected and get back to activity. Dr. Yee, we would love to have you come back. I want to talk to you in the future about ankle arthritis because you stimulated some thought process in my mind when we were talking. But thank you for your time today.
Thank you for having me.
That's been Dr. Anthony Yee, and you can get more information, SeattleOrthopedicCenter.com. That ankle kind of, Shannon, very, very important in all that we do, whether it's biking, walking, hiking, anything of that nature. We need to have a good, strong, stable ankle.
Your ankle, your feet, they're the foundation of your body, just like the foundation of the house. If the foundation isn't good, the upper stories are not going to be good. So, yeah, this is the foundation of kinetic movements, for sure.
All right, we'll be back with our final segment after this time out on Northwest News Radio.